So that's what this talk is going to be about. It's going to be about the goals of NeuroHab. And before we start, even just the word NeuroHab, if we think about it, it's very different to other types of rehabilitation. Their movement dysfunction is the disease, the cause of their pain symptoms. And if you don't eliminate movement dysfunction, you will be chasing your tail forever and a day trying to control your spine pain or your back pain. Number two is we want to promote the natural and definitive, that means complete, natural and complete or natural and definitive healing of pain generators. Good afternoon everybody, David Johnson here from City to Coast Neurosurgery, the Back Pain and Functional Movement Training Centre. I sincerely hope you're all well and coping with the extreme unforeseeable restrictions that are currently imposing on our lifestyle at the moment. Just wanted to give a brief update on what we're doing here at the Functional Movement Training Centre. We're still seeing patients, of course. We're seeing them via telemedicine. The Functional Movement Training Program is still being delivered via telemedicine as well. We also do have a very large facility in Brisbane, not part of the hospital, where patients are still attending for their important medical services in very small groups, and so that's still actively running and going very well. In terms of surgery in the hospital, we're restricted to emergency cases, of course, and in terms of elective surgery, we're only doing Category 1 elective surgery and urgent Category 2 elective surgery. So those are for patients who have some neurological deficit or they have extreme pain and disability that still meet the criteria to have surgery during the restrictions that are being reserved for the management of the respiratory illness associated with COVID-19 severe acute respiratory syndrome. Sincerely hope that no one that you know or yourself is suffering from that, and that we can all move on with our lives when this is all over and resume the wonderful lifestyle that we have. So putting that aside, I thought I'd just take the opportunity to talk to you a little bit about spine pain and in particular back pain and the NeuroHab program. I just realised that I've never really talked to people or synthesised in a nice, concise way what the goals of NeuroHab are. So that's what this talk is going to be about. It's going to be about the goals of NeuroHab. And before we start, even just the word NeuroHab, if we think about it, it's very different to other types of rehabilitation. Obviously, hab means rehab, and neuro means the central nervous system, okay? And why are we rehabilitating the central nervous system? It's not like anyone's had a stroke or a brain injury or anything of that nature, but we are rehabilitating coordination. And as you all know, coordination is driven from the central nervous system. Some people are good at things, some people are bad at things, and that's because their central nervous system motor pathways allow them to be very good at something or not very good. Say playing the guitar or piano, they've practiced that part of their central nervous system to be good at it. And likewise for sporting movements such as tennis or golf or swimming. You're either coordinated or you're not. And so NeuroHab focuses in on the central nervous system's coordination for movement in life, okay? And we want our patients to be good at moving in life. Activities of daily living, ADLs. I'll try to write neatly so you can see what I'm writing. And that is by far the most important sport that you will ever play, the most important coordination that you require. And sometimes I even use the term the sport of life. Okay, the sport of life. And it's very important to be good at the sport of life if you're going to avoid musculoskeletal pain and spine pain. If you think about other types of rehabilitation, they're focusing very heavily on things other than the central nervous system. So we could think about other things that you could focus on as part of your rehabilitation: muscles, ligaments, tendons. Okay, all of that is addressed when you get stretching. Okay, when you do exercise, when you do core strengthening, or if you do Pilates, or even if you have surgery, okay, or if you have injections into the spine, or if you take medications, and the enormous amount of different manual therapy that is conducted, you're focusing in on these things here, but you're ignoring the central nervous system, which is controlling movement. Okay, so that's why we've called the rehabilitation program that is delivered at the Functional Movement Training Centre. That's why we've called it NeuroHab, because it's distinctive from other types of rehabilitation. And I don't believe that there is any other type of rehabilitation program that specifically and distinctively focuses on movement proficiency as its target. Now, I have previously talked about NeuroHab and the 1, 2, 3, 4, 5 movement points of performance, MPOP, movement points of performance, and how we define good movement versus bad movement. I'll very briefly write them up here. So we want awareness of neutral spine positions. Okay, and often that's linked in with your pelvic, neutral pelvic position as well. Number 2, we want hip centric rotation. Just getting a little bit sidetracked here because these are in other seminars that I've given, but just so that we can complete the video. Hip centric rotation. We want unloaded knee positions. Unloaded knee positions when we bend and move. We don't want to load our knees and give ourselves a meniscal injury or damage our cruciate ligaments of the knee and end up having to have a knee replacement down the track. We want to have posterior kinetic chain powered movement. Okay, that means using our posterior musculature to drive our body into movement tasks. And we want you to be aware of your range of motion. Okay, not everyone is going to have the same range of motion, but that doesn't mean that not everyone can move well. It's just that means that some people may not be able to move to the range that someone else can move. But proficiency limited range of motion is the other movement criteria that we have to keep in mind when we are abiding by the rules. Okay, these are the rules of the game of moving well in life. Okay, being good at the sport of life. So those are the 5 movement points of performance, and I've given other lectures about why they are relevant. That's not the topic of today's video. Today's video is talking about the goals. Okay, so once you have engaged in the 8-week NeuroHab program, 16 hours, 2 times a week, what are we wanting to do for you? Okay, what are the goals? And again, when I sort of thought about it in a very succinct and concise form, it falls into 5 main goals. Let me know if you think there's any other goals, but there's 5 main ones. Okay, so number 1 is we want to cure the disease of movement dysfunction. Okay, because this is at the top of the tree. This is the root. This is the seed of the problem. Well, it's the seed of the problem, not the top of the tree. This is the base problem that is driving all of the symptoms that patients come and talk to me about. Their movement dysfunction is the disease, the cause of their pain symptoms. And if you don't eliminate movement dysfunction, you will be chasing your tail forever and a day trying to control your spine pain or your back pain. An obvious goal. So number 2, and when we actually do eliminate movement dysfunction, these other factors will automatically play out and start to be achieved. Number 2 is we want to promote the natural and definitive, that means complete, natural and complete, or natural and definitive healing of pain generators. Okay, so pain generators, so you can slip in there back pain generators or neck pain generators, okay, or thoracic pain or hip or knee. You can slot in whatever it is there. And those pain generators may be things like a discitis or inflammation of the disc. We call that discitis. Okay, we might have an inflamed joint, like a facet joint. We can call that arthritis of the facet. You might have a tear of the disc capsule, which is, one step before a disc herniation. So you might have an annular tear. The annulus is the capsule of the disc. Annular tear. And guess what? Those things are painful. Of course an inflamed disc, of course an inflamed joint or an annular tear is going to be painful. It's no different to you spraining your ankle as you step into a pothole. Of course you're going to tear ligaments and tendons. You may even injure the cartilage of the joint of your ankle, and it's really, really sore. You expect it to be sore. But when it comes to your ankle, most people know how to allow those ankle structures to definitively heal. But when it comes to these structures in the back, people get a bit confused and they don't know how to make these structures heal. Once these structures heal, the pain settles down. But they will only heal when you've established movement proficiency to stop applying the biomechanical stresses to these structures, which then allows them to naturally and definitively heal. Okay, makes sense, right? Number 3 is preventing, I'm going to use a different colour because I'm running out of ink. We want to prevent re-injury. That's logical, isn't it? Because if you sustain an injury and you get one of these structural insults to your spine and it hurts, and once you've allowed it to heal, we don't want you to go out and go back to work again and the first day back on the job sustain a new injury. So because you've learnt those rules of movement that were part of neurohab, it minimises your risk of getting another injury as soon as you get back to work. Okay, so that's really, really important for our workers' compensation patients. But just remember that everyone is working in some form or another. Even if you don't have a job, you're still working by doing your normal daily life activities, whether it's cleaning the house or getting out of bed or doing hard physical labour. The next point is also relevant to working, and that is in regards to building functional capacity. So we want to build functional capacity on a foundation of movement proficiency. Okay, so what does that mean? Everyone has a level of functional demand in their life. It doesn't matter whether you're a bank manager, teacher, checkout chick, or a Olympic athlete, or you know, climbing Mount Everest. There's a functional demand applied to your life, and you have to have a functional capacity to meet that demand. If your functional capacity is down here, you are going to, and you've got to do this task, you are going to sustain an injury. Okay. If the functional demands of your task is here and your capacity is up here, you've got a buffer of safety. Okay. That's a favourable mismatch. This is an unfavourable mismatch. And so what can you do? You either say, no, I'm not going to do that task, and drop down your demands so that you meet your low functional capacity. Not many people have the luxury of doing that. And most people do like to do physical tasks and activities such as sport, or you know, playing a game of golf, or mowing the lawn, and they've got to do those things, or they like to do those things. So the alternative to dropping them and saying, I'm not going to do them anymore, which is what a lot of people do, oh, I just won't work anymore, I'll go into a disability pension or something like that. The alternative to that is to say, well, I'm going to build my capacity up so that I meet that demand, preferably build it up a little bit higher so there's a safety buffer. But you cannot build functional capacity until you've first got rid of movement dysfunction, okay? And if you try to build functional capacity by just saying, okay, I'm going to go to the gym, or I'm just going to keep working harder, you will just plummet in a heap of pain and disability, because when you engage in that non-movement proficiency approach, you will just re-injure these structures, and they'll all become inflamed again, and the pain levels will go up, and that'll stop you in your tracks. And so therefore your functional capacity will always be low, and you won't be able to achieve those requirements that are part of your life. All right, the last one is related to unwinding. The goal is to progressively, because it doesn't happen straight away, progressively unwind central pain pathophysiology. Physiology. Okay, remember, central pain is pathological pain. It is not normal pain. Everyone knows what normal pain is. Just pull your hair, pinch your skin, poke yourself with something sharp or hot. That is normal pain. Central pain is pathological pain. No one is meant to feel central pain, okay? But when you've had back pain or neck pain for a very, very long time, years, some people say they've had back pain for years and years, they will have developed central pain, okay? I've got some lectures on our page and our website talking about central pain. But if we're going to help the central nervous system, and that's why it's called central pain, because the central pain abnormality is up here in the brain. It's not down here in the back itself. It's not in these back structures anymore. Well, it can still be in the back structures. There's no rule that says you can't have structural pain and central pain, but there's a large overlay of pain that's being generated in the central nervous system, and that's why we call it central pain. Patients who have had pain for a very long time will have started to develop those central pain pathophysiology processes. And if we're going to help the brain unwind those abnormal connections between nerve cells in the brain that are driving this central pain element to their overall picture, then we've got to reassure the brain that there is no further threat to these structures, okay? And by eliminating further threat of injury, because you're moving well, the brain can slowly and steadily unwind central nervous system abnormal neural connections that are part of that really difficult component to fix. And it's because people don't start functional movement therapy at a very early stage in their history, okay? If you had a pain for 2 or 3 months or a few weeks, or just on the weekend you started getting back pain, and instead of just leaving it to just get better naturally, and then the next time you go out and mow the lawn you get back pain again, or the next time you go out and play golf you get back pain again, if you actually engaged in the definitive cure of movement dysfunction through neurohab, you would never work your way down to number 5, okay? Because if you fix movement dysfunction very, very early, you don't ever need to worry about these ones developing, all right? But the big problem is that most people that I see have not had pain for a week or two. They've had pain for a very long time, and I really want to get the message out there that people can minimize their problems with chronic pain if they start functional movement therapy early. And neurohab, as far as I'm aware, is the only program, is the only method that focuses specifically and distinctively on eliminating the disease of movement dysfunction, which is the seed of most people's problem. All right, I think we've covered a fair bit there. The video is probably a little bit long, sorry about that. Once again, I hope everyone's coping, and I really sincerely want you all to stay safe and everyone help each other in re-establishing the wonderful lifestyle that we have in Australia. And thankfully the news is good. We're flattening the curve. Keep it up. Talk to you next time, guys. Bye.